So, uh, so NAMI is the National Alliance on Mental Illness, and I do want to give my thanks to Leslie Stoyer. She is the just about to retire from NAMI Summit County executive director. Jamie Messenger, who's been there, will become the executive director for NAMI Summit County, and then Luke Russell, who is the current and ongoing director of NAMI Ohio. So some of you may not know that this started way back in 1979, literally by a group of women who called themselves the NAMI mommies. They had sons and daughters with schizophrenia, and as hard as it may be sometimes now, it was almost impossible to get good care for their loved ones at that time. And so they started a grassroots organization, and it's probably, in that respect, one of the most successful grassroots started advocacy organizations in the country. So very, very powerful. Ohio has a particularly strong chapter, if not the strongest, one of the top two in the country, and a lot of great leadership there over many, many decades. In fact, has really made that to happen. So NAMI, therefore, starting as the NAMI Mommies, is about family. The big uh, goal is access. How do you get your loved one access to care in a complex system, that is fraught with problems around payment, and payment streams make the system more complex and so forth. But over the years, NAMI has grown. You can see here the areas that have their service. You see some that are working together. These, uh, I guess, candy canes, we'll call it, for Christmas type areas. And so you'll see that. So they really are working on that. We know that 80% of all caregiving, even in the current world with serious mental illness in particular, is by family. And so family is very important. And normally what happens is a person's loved one is struck with a mental illness, and generally the NAMI focuses on the most severe mental illnesses. And the family, even a family where one or both parents are healthcare providers, they don't know the system, and they're left with what do we do now? And unfortunately, as you know, most of those serious and persistent mental illnesses start right at the point where the person is likely about to start a responsible part of their life, right? Somewhere just before or after official adulthood at age 18, the most common window. So high school, college, or if they're in a trade school, if they've gone to get a job right out of high school, what have you. So very, very serious timing, and the family is, at some level, wrestling with all those. Oh, the person's going to leave the house. At another level, they're excited for them to go start their life, and then they get hit with an illness, and they really don't know what to do. So the other thing is, across the state now, we have 38 local affiliates. They cover most of Ohio, and there's currently work to try to get to go beyond the 38 and to actually get more areas covered. And you can see some of the work that goes on working on getting some of these organizations together. There is some money that goes to NAMI National in Washington D.C. at the national level. There's some money that goes to NAMI Ohio, and in general, NAMI Ohio then shares their money with the affiliates. So we do have an annual meeting with all the affiliates are invited. We work with the affiliates to make sure that they have the resources they need, but understand that in general, the affiliates are mostly volunteer with a small staff who may get some money, may get paid. So NAMI Summit County has done very well in that respect, but not all the affiliates are at that level of affiliation. So what do they do? Again, it's really about family. So they give support, and in fact, so NAMI Summit County does, and you can see here, hundreds of requests each year. NAMI Ohio, thousands. Their phone rings a lot, and when their phone rings, in general, it's a family member looking for help for their loved one, and it may be as extreme as they've been in the state hospital for 3 days. They want to kick them out. They have no resources for this loved one. We got to do something about it. Sometimes Ohio is able to step in and negotiate with the state hospital. Nope, they're going to keep them. This person really needs a few more days while we get some sort resources taken care of and so forth. And sometimes that leads to really positive outcomes, such as Dave Morgan. of the PEGS Foundation, he actually, that's what happened. Reached out to Terry Russell. The family did at the time. Burton Morgan, an entrepreneur, and his wife, Margaret Clark Morgan, ultimately went by PEG. And NAMI helped their son. And that has turned eventually into a foundation, PEGS Foundation, that's done a lot of great stuff for mental illness because of that, because of their son who's still alive with schizophrenia. So that's how this works. It's people helping each other, a lot of education. I'll walk through some of their programs real quickly here so you have a sense of the breadth of what they do, all of which is provided free. So they don't accept any money for any of the work they do. Obviously, there's a donation drives here and there to cover that, but there's no expectation when you reach out for your loved one or yourself for that matter that they're going to say, "Oh, where can we send you the bill?" And none of that stuff happens. And then advocacy is huge, and I'll come back to some of that toward the end as we talk about Ohio budgets around mental illness. So there is a big campaign now, Talk Away the Dark, working with NAMIs as well as the American Foundation for Suicide Prevention. As you're all aware, we have one of the worst rates per 100,000 of death by suicide this country does compared to the rest of the world. The world's been going down, down, down in terms of that rate for 2 or 3 decades. We've been going up, up, up. Last year, we had more than 50,000, worst year ever, Americans die by suicide. So a lot of energy being put into this, including, of course, the families through NAMI. So I won't say too much about that today, but oh, I got this twice. Okay. So family. Let me go into I'll do some programs, some classes, some supports. So programs, family to family is truly their signature program. So if you suddenly have a family member who develops a mental illness at any age, but in general, we're talking about often a young adult, and the parents therefore are, into their career, but probably not retired yet in general. They are like, what do I do? And so they can go to a family to family class, and the classes are led by other people who've been there, done that. So it's a peer support type process, but it's been around for a very, very long time, long before we talked about peer support in the way we do now. And so the family members who have been there, done that, will teach the class to family members who are newly into this vast array of what's going on with my loved one. So phenomenal outcomes with this that saves a lot of headaches, a lot of steps, including saving a lot of money being spent needlessly. A lot of individuals will, if they happen to have the means, will start trying to throw money at the problem. That, of course, is not really a solution for mental illness, right? You can't pay your way out of schizophrenia. So that doesn't work, and the parents can quickly learn, don't throw your money away. There's some places where maybe having some money is helpful, but the reality is they want to get a better way to handle crisis. One of the things they teach them, by the way, is if you have to call 911, to specifically ask for a CIT trained officer. So NAMI is a huge partner around crisis intervention teams nationally, but particularly in Ohio, because we have such a robust CIT presence across all 88 counties now. So what do they do? So just in general, these, so I'm not going to review this, but they do teach the families about warning signs. So here's one of their slides that they will use just as an example of this. So watching for things, right? Remember, this is to teach family members who have no healthcare background like all of you do, right? So we're a little jaded. We forget how little we knew before we had our education, whatever education and whatever specialty you've all got. So we forget that. So we talk to families that this happens, and now they're distressed for their loved one, and they really don't understand this. They may work for, I'll make it up, Gojo, Purell, right? So they may work for Gojo. They may have a sense of healthcare, like infectious disease, but they may have no knowledge of anything like mental illness. So they look for what's going on with your loved one. Oh, they're avoiding their friends. They're starting to socially withdraw, which we know is on the list of a number of our serious mental illnesses and so forth. They may want to be aware that the person may be thinking about dying by suicide because they also were ready to launch their life, and suddenly they're put upon by symptoms that they don't understand. So they teach this so that the family members and support people understand what's going on. So, more signature programs. These are the classes, right? So we have family to family, which is very interactive. A family working with other families over about 8 weeks to really get. Again, this is done uh, small increments, but over periods of time. So for the longer one, the family to family, these are smaller ones. So these are classes. You'll see each of these says the word class in the description. So NAMI Basics. So this is for youth, which is defined as 22 or younger. They can now do it online, right? COVID did also alter these, so it makes it even more convenient for family members, guardians, even to learn what to do with this around mental illness. We've got the NAMI provider, right? So maybe mental health professionals, we all work in our areas, and although it is a team sport, we still find ourselves in silos. Maybe we need some knowledge we don't have. So if NAMI takes it upon themselves to make sure that we also can learn from the NAMI provider classes, peer to peer, right? So adults that have their own mental health conditions, they can work together. So this helps with that process as well. And then NAMI Homefront, which deals with all the caregivers around military, so veterans. So we also have that additional component set up for veterans and their families. Then we have the recovery support groups called NAMI Connection. So this is, you see on the left here, the others were classes. These are support groups. So we see this NAMI Connection group, also very powerful. Again, it's designed for adults. Weekly for 90 minutes, right? Every other week, I should say. So it's really twice a month. And it varies, right? So this is kind of like an AA meeting. You look it up in your area to find out where your times are. Summit County obviously has their times, but there may be different times for Stark County, Portage County, etc. So that's the kind of work that you need. You have to do a little bit of legwork to go to their website to find it. But these groups run and they're very welcoming. Again, they're free. So that's the big piece here. Family support groups. So beyond family to family, what do you do after that? So you've got a family support group to work with on this again, because ongoing challenges, but it's groups of people now who are either have been there, done that, or are currently still going through all this, trying to get the right services, the right supports for their loved one, and that's what this does. Very, very powerful. This group actually used to meet when I started my career in Ohio in Toledo. They would actually come to the state hospital periodically, and myself and some others would talk to them from a professional perspective, like what's going on here. So I would talk about their loved ones who were found not guilty by reason of insanity, which is, the media says one thing about it, but having your loved one actually in that path, and you need a lot of education. So the families would come and we would have very candid discussions, not about any individual, but about in general how this all works, and very well received. The family members, we had family members actually who continued to come long after their loved ones were out of the hospital. They'd still show up to learn more because, as you know, you can be a civil patient today and a forensic one tomorrow, and vice versa. So these families had learned enough of that through NAMI, through family to family, through their support groups and other groups. So they were able to gain by showing up at these events. And then there are some that are a little bit less direct, which are the presentations, right? So ending the silence is one of those presentations. So this goes into the schools, but also works with the school staff, the teachers, the parents and guardians of the youth, trying to give them what are the signs, right? How do we get ahead of this before hopefully it starts? Now, we know that some of this, a lot of mental illness does start in that 14 to 22-year age range, but if we can get ahead of even that and make sure the families are aware, help destigmatize this, getting rid of stigma helps people come in sooner during the course of an illness, which of course we know in many cases will decrease the morbidity of that illness, and the person may go on to have a much higher quality of life thereafter. So these are very important. Family and friends 4-hour seminar, again, more just overall education. What are these diagnoses? And again, they focus on schizophrenia, bipolar disorder, serious major depressive illness, that type of level of illness. Where are the resources? So that's why these are generally done locally, right? Because you need to know the local resources. So NAMI Summit County will have to, and does a great job of this, educating the resources. Stark would give a different list of resources, right? They may have certain signature classes, presentations, et cetera, like I'm describing to you, but they may have very different arrays of service to make sure people are aware of them in their area. NAMI Summit County has done this so well that they, in fact, were one of the groups that really thrived during COVID, and many of the other ones really struggled. Not their fault, because a lot of everything struggled during COVID, but NAMI Summit County did well and ultimately was the chapter of the year only a few years ago. So they've continued. They even got recognized for the added work that Leslie Stoyer and her team were doing at the time. In Our Own Voice is another presentation, more to the general public, to make people aware of mental health conditions. What does it really mean? Again, destigmatizing, trying to get the word out. And really importantly, partly to get the NAMI word out so that people are aware NAMI even exists. So that if they have this happen, because we know it's going to happen somewhere, people know who to call when they're really at wit's end and so forth. So then, of course, we also have some programs specifically, although NAMI's focused on the family support, they do have some for clients. So a lot of different programs that are worked out here for the families. Now, this specifically is NAMI Summit County, so each county has their own things. These are not dictated by NAMI Ohio or NAMI National. One of the things you've not heard me mention, by the way, is substance use. So although there's huge overlap, NAMI National has continued to indicate their goal is to focus on the mental illness side of things and not on the substance use. So that's why you're not hearing me say too much about that, just to point that out. That's a NAMI national issue, which means that the state ones really can't go there either, and the local ones don't. But we all know the overlap is 50%. Probably for serious mental illness, it's 60 or 70%. So we know this happens, and so we do end up sharing those resources as well. So Creative Kids, obviously focused on the youth, right? Letting them, and during the course of these, they learn about mental illness, right? So maybe it's their mother that has the mental illness, right? Maybe they need to learn something, so have a much better understanding of what's going on with themselves and or their parents. Housewarming, this is phenomenal in Summit County. And again, all for free. So you get somebody who's been hospitalized or not, but very ill. They are able now to get into their own living space, often later than the family may have preferred because of the illness got in the way. And so they provide, look at all the things they provide for free. Really gets them going, allows them to walk into an apartment and have the things you would need to survive in that apartment, as opposed to having to find a lot of money and go to Walmart or Costco or Home Depot weekly for 6 months until you get your place set up. Right. So when you end up in the new place, that's what happens. So this really helps them to do that. Needy souls, they are able to get a voucher. And what we know about people with mental illness is one of the things they often do is pace a lot and walk a lot. They go through shoes. So Needy Souls gives them a voucher to go to the shoe store and get a brand new pair of shoes, I think at this point annually. So they're able to get new sets of shoes for free, which, as you know, shoes have not dropped in price. And so some of these are very expensive. So that's a huge one for not, I'm not sure I've heard of any other NAMI other than NAMI Summit County doing that particular one. They do a lot of work with the Akron Barber College and the Beyond Expectations Barber College around hair care, right? People, if you get yourself made up and you look better, you feel better. There's a lot of evidence behind that, right? If you smile enough, you'll actually ultimately feel better. So they really want to encouraging people to continue the added, if you will, activities of daily living that we all benefit from, grooming and hygiene and all these things. So this is another great one that they've partnered with. Of course, there's a huge need for socialization. You've all seen now that our Surgeon General, Dr. Murthy, has even put out a report on isolation that we learned a lot about as human beings during COVID, some much more than others. And then that result is not good. Right? Too much isolation leads to bad mental health outcomes, maybe even death by suicide. So getting people activities that they might not otherwise go out and do. This gets people involved. Let's give you opportunities to do things so you feel like that. So advocacy, right? And advocacy, some of it's at the national level, some of it's at the state level, and then some of it is just in your own area in terms of local politics. Because, as they say, all politics are local, but in fact, of course, there are some things that need to be dealt with at the state level. Ohio, again, very strong advocacy with NAMI Ohio interacting with everybody up to and including the governor on a very regular basis. And I'll mention that here. So what has happened literally in Ohio under Governor Kasich actually was very solid in terms of the money that he and his administration put towards mental illness in Ohio. Governor DeWine has really ramped that up. He's been phenomenal. And again, his whole team. And so when they knew they were going to have more money, which in some of the budgets now has been hundreds of millions of dollars more than previously for mental illness, he literally came to NAMI, Ohio and said, "Hey, I'm going to have this kind of money. How should I spend it?" And so our board meeting would meet and we would do a lot of small group exercises. We'd walk through a lot of data. We were able to say to the governor, "Here's what we think." And some of that happened. The governor listened, and of course, it goes through the legislature and all the other stuff. But ultimately, lots of good things happened because NAMI was asked, not we didn't ask him, he asked us, was asked to be at the table. Even when he ran for governor, both people who were running for governor at the time came to NAMI as opposed to NAMI going to them because they want to know what they should do around the mental illness. I certainly hope that happens again when DeWine is unable to run again. So we'll have two new individuals. Hopefully they also both, whoever they are, I don't have any idea who they might be at this point, will come to NAMI, Ohio and meet with us and get into conversation. So that's a great way to show that advocacy works because if they start coming to you, then obviously they know that that's important. Another place where NAMI Summit County is very specific is they show up in Judge Stormer's assisted outpatient treatment court every time. So NAMI is always there, helping the families who may have a loved one in court who's on assisted outpatient treatment. So that's phenomenal. They go to the mental health courts, right? So our judges in Summit County, Judge Bro, for example, runs the Hope Court, HOPE court. So they go to her court. They go to all the various courts. Judge Coates runs our Muni court in Stowe, which covers a region, Stowe, Hudson, some regions, right? So these individual judges, Judge Williams, I think is currently actually the presiding administrative judges for all the mental health, all of the criminal justice courts, which include these specialty dockets, as they call them, so drug courts, mental health courts, etc. Judge McKinney as well as part of that process. So this is a great connection because families are there and they are stressed. And this may be, unfortunately, as you know, how people got into the system. Mental illness got developed. They end up coming to police attention. They end up in court for a crime, which may be very heavily related to their mental illness. And so having the family support right there, ready for the families is phenomenal. NAMI walks. So they do have to raise some money, right? So they have one large fundraiser nationally. A lot of the chapters or states do this. So Summit County has done this extremely well for a lot of years. They just had their NAMI walk in September for this year. They'll do it again next year as well. And it's teams that walk. NEOMED has a team. ADM board has a team. A lot of the hospitals have teams. It's awesome. And it's, you can go hang out or you can walk or you can jog if you want to. And what they've done, it turned out being Northeast Ohio, that almost every time we did this outside, it was raining. So they worked it out, University of Akron. And for that morning, for free, University of Akron lets us use the Stiles Field House so you can walk the track and they can set up things inside and vendors can have a table. So NEOMED can have a table and ADM board can have a table and the agencies. So family members who are walking also get to see an array of the services. Another way it's partly educational. And ironically, since they've moved it to the field house, I think every time it's been nice out, relatively speaking. But so some will walk outside, some will walk inside. If you want to bring your pet, nowadays they want it outside, I think. But anyway, you can look for that in your area, or if you're in Summit County, you can look at their website. So You can reach out to get information. Here's the website locally, NAMIsummit.org. Of course, there's NAMIOhio.org, which is our parent organization. And then there is, of course, the national level, NAMI.org. Lots of information. So if you're looking for this, or you've got, as clinicians, you may have a patient and you may want to help their family by saying, hey, you know what? You might also benefit by reaching out to your local NAMI and see what they can do. Our law enforcement through CIT it works both ways. They will hand out a flyer to the families when they go to the home and say, you know what, maybe you ought to call NAMI, get yourself some help. We likely in that case escort your loved one to PEZ or an emergency department, right? So that's a two-way street. Get the family some help while they're getting help for their loved one. And then, of course, moved on to high tech now. So there's an app for NAMI Ohio. There's a phone number to call. Apart from the local line for Summit County, there's, of course, the line for Ohio. So the idea here is that we want people to know how to reach NAMI. We want people to have those conversations. And some of them are fairly straightforward, just looking for a little guidance. And some of them are, as I mentioned, like, my loved one's about to be kicked out of the hospital way too soon, and we need help, either for a better place for them to land, or for them to stay there a few more days while we get some more help and that sort of thing. So very, very powerful. You can see chatting even occurs here. So they've made this a lot more user friendly for even youth. They may or may not want to call, but they may text and chat. Speaking of youth, there is a youth and family division. So going way back in time, I joined NAMI, I think it was 2015, although I did some stuff, as I said, with NAMI in Toledo way back in 1998 through 2002 as well. So in this, there used to be the Children's Federation in Ohio, and they were a group that really advocated for the youth. Ultimately, it was very difficult for them to make that go by themselves, so they approached NAMI Ohio, and ultimately they helped them out, and ultimately they asked to merge. So they're part of it. We still at our board meetings. We just had our board meeting 2 weekends ago in Columbus. We all do go there in person on Friday and Saturday to really walk through lots of big issues, as you know. And so youth is part of that. So we have a report out about what's going on in the youth side of things for mental illness as well. And Youth Move, which is literally about a lot of movement, a lot of energy there, so dance moves and so forth. Wonderful organization, youth-led. They even will often demonstrate at rallies and things of that peacefully, in Columbus. And I've even seen pictures of the director of OMAS out there with the youth when they show up and so forth. I suspect Governor DeWine's been part of that at times as well. So very, very positive getting that information out. And of course includes and it supports inclusion as well, really about everybody trying to get this piece of that. So okay, so it is the advocacy priorities real quickly. Person-centered is everything, as we talk in the meetings 2 weekends ago. Person-centered, person-centered, person-centered. Very, very important that is really with a focus. Of course, we need crisis services and inpatient care. We had big discussions about the governor's work group report that was just published, which is focused more on forensic, but the theory being let's keep forensic patients from being in the state hospitals, open up some civil beds. So that's what we discussed a lot about that at our meeting recently, to figure out what does NAMI want to support from that report and advocate for. Housing, of course, is huge. We visited our second day of the meeting on Saturday. We went to Melissa's house down in the Franklin County area. Oh my gosh, it's phenomenal. Apparently, from what they told me, it is an amazing house, and it's being updated now to have the full allowable 16 beds. It is not your grandfather's group home. Any of us would be fortunate to have a room in this place. It is phenomenal, and apparently they've learned it is the nicest group home in the country. It is so nice. Just amazing. Named for a woman with mental illness. Her mother ultimately donated $500,000 to the effort to get this home, which ultimately is going to cost, including renovations, $2 million plus dollars to really get this going. But then it will help, and it's in a standard residential area. They got past the not in my backyard issue, so it is a beautiful neighborhood. It was phenomenal. I'm glad we got to go over there and have our second day of the meeting at sort of a lengthy, almost looked like a Thanksgiving table that they were able to fit in the dining room area, which tells you how big the place is, right? Because it's got to fit 16 people when they're fully occupied. So, and then day services, right? Very supportive now of clubhouses. Magnolia Clubhouse up in Cleveland is a great example of a true clubhouse model. We have choices in Summit County. There is even some discussion about that potentially someday becoming a true clubhouse, gets into fidelity and evidence-based practice things. We have the Summit Recovery Hub, relatively new. I think it's now a year old under China Darrington and her team. Excellent additional resource in our community. So that also, there's been discussion, how could that do more clubhouse work, et cetera. So very, very important. And then they are very much involved in supportive employment, which I know Community Support Services does an amazing amount of this work as well. Okay, so you know this is coming from Governor DeWine. What are the things that need to happen for people with serious and persistent mental illness? Some of this is happening, some it still needs to come. Governor DeWine is oft quoted now because he did say this: the system isn't broken, it was never fully built. And it also doesn't exist everywhere in Ohio. And I think he's almost 100% correct about that. Part of the problem, of course, is some of it was built and got dismantled. That is 17 state hospitals, and now we have 6. So there's a movement there, and he recognizes that. And with some discussion, he's earmarked some money to set up a plan to design a new state hospital to be built in Dayton, which is ironic since they closed the one in Dayton. All right, so that's one of the ones that closed. And then the other thing NAMI's been doing, just to finish up here, is to help families understand when to call 911 versus 988. I'm not sure I've seen anybody else doing this work. This is truly a NAMI mission, because all of us are at an age where we probably were either not born or were very young when 911 launched. And that one apparently took a lot of years to become a household number, right? We don't realize that because to us it's, yeah, call 911, right? I mean, that's pretty straightforward. 988 is much faster because of the modern age we live in and social media and everything else. But it's still, there are people, I've been in audiences as recently as last month where somebody asked who knows about 988, and fully half the hands did not go up. They had not heard of it. That included first responders in some of who are part of the participants. So not everybody's aware yet of this and how this works. So there's a movement at the state level, but also locally, trying to work on when do you call 911, when do you call 988. And then I know in Summit County and other places are trying to figure out how to set it up so you can seamlessly, whichever number you call, they'll shift you to the other number if need be. There's a lot of work on that without putting on hold. Obviously, somebody's in a crisis when they call either number. So anyway, lots of groups work with NAMI Ohio. That's the only way this gets done. NAMI Ohio itself is a very small team of paid individuals in Columbus. And some of our members actually have also sat on national NAMI. So we have board members, one still actually sits on national NAMI. And so you can see here a sense of, and the other partners we work with, such as Justice Stratton, Judge Leifman, who you've probably heard about in Miami-Dade County. I think he's actually now just about to retire, but he's done a lot of great work. So we really look to partner. So that, as usual, there's my contact information, and I will take questions.